Hi, everyone, and welcome to week 5. This week we're going to discuss communication, and we're going to explore policy issues that enhance patient satisfaction. We're going to describe a policy to address patient satisfaction. We're going to develop political competence about a policy and utilize effective communication to interact with a legislator on a policy issue. Now, let me just begin by saying you don't have to actually interact with a legislator, but you're going to prepare a PowerPoint in preparation of talking to a legislator. So our discussion question says to consider the most pressing healthcare problems related to patient satisfaction in your practice. So you can individualize this. Explore related policy issues that address patient satisfaction and describe a policy to address patient satisfaction. So just remember, we always talk about patient satisfaction, but what we're really measuring is patient experience. The terms are often used interchangeably, but they're not the same thing. So patient experience is finding out from the patients whether something that should have happened in a healthcare setting, such as clear communication, actually happened or how often it happened. Patient satisfaction, on the other hand, is about whether a patient's expectations about a health encounter were met. So two people can receive the exact same care, but have different expectations about what is supposed to happen. So they can give different satisfaction ratings. This is a little chart that I find helpful when I'm trying to think about the differences, and I will put this in the announcement section, or I'll put this chart in the discussion section so you can see it. So when we think about patient satisfaction, we're thinking about the HCAHPS surveys, all right, the Consumer Assessment of Healthcare Providers and Systems. And you can see patient satisfaction scores on the internet. Patient satisfaction measures these 10 things, and actually pain management has been taken out while they're working on a new question. I'm going to take you over to hospitalcompare.gov. I'm thinking that most of you have been to this website, at least since you started in the RN to BS program, but you can get there by just Googling medicare.gov. Hospital compare, and then you compare different hospitals in your region or anywhere actually on different things. You can see the different things up here. But I want to take a look down here at the survey of patient experiences just so you can see what kind of questions that they ask. I'm from Western Massachusetts, so I put in 3 of the local hospitals here. And these are the kind of questions that they ask. What percentage of patients reported that their nurses always communicated well? What percentage of patients reported that their doctors always communicated well? So you can see right there the term always is hard to quantify. So if one doctor did not communicate well, then the patient isn't going to score it as always. They always received help as soon as they wanted. They always got their medications explained to them. They always got, their bathroom was always clean, and so on. Some of the ones that are really important for discharge is patients strongly agree they understood their care when they left the hospital. Patients who gave their hospital a rating of a 9 or a 10 on a scale from 0 to 10. You can look at these scores for these hospitals. This is the Massachusetts average. This is the national average. So one of these hospitals is below average in getting that rating. And patients who reported that, yes, they would definitely recommend this hospital. Again, Massachusetts average, national average. These hospitals are all just barely above that. They did take the pain question out. That said something like patients who always received, were pain-free or always received pain control, something like that. And they took it out because they're going to actually redo the question because that always was just, it didn't really fit well with the question about pain because a lot of people don't get rid of their pain. That's patient satisfaction. Now you could look at, say, unplanned hospital visits. There's a little video here that you could watch if you wanted to, but it also talks about some of the things that many of you have been talking about in these last 2 weeks, 4 weeks actually, unplanned readmissions and hospital visits by procedure. So they're talking about your joint replacements, and then here unplanned readmissions for after heart failure. And then it'll tell you the measures that need to be done for patients that are having heart failure. These aren't actually giving us any rates up there. But if I click on this link, it'll tell us a lot about the quality measures of the different diagnoses and why they're important. Okay. And if we go back here, you can also go and see some other things, timely and effective care. I think most of you know that sepsis is now one of these core measures that they're measuring, how quickly people get the appropriate care when they have sepsis diagnoses. Heart attack care, people who get the aspirin when they're needed or get transferred when they need it or get an EKG when they're needed. So all of this kind of stuff is on the website, and Medicare will look at this and hospitals will get compensated depending on some of these measures. So our patient satisfaction experience scores are pretty critical to how well patients do. Research has identified a clear link between patient outcomes and patient satisfaction scores. And again, I'm going to put all of these links into the announcement so you can look at them if you'd like to. How does it impact reimbursement? Medicare reimbursements are tied in part to patient satisfaction portion of the survey. Compliance regulations are linked to reimbursement penalties as well. They use the patient satisfaction experience as a tool for strategic and competitive advantage in gaining market share. So you'll see that a lot of hospitals are using Facebook, LinkedIn, Twitter, Instagram, all kinds of different places for sort of advertisement. And a significant portion of reimbursement and revenue growth are attained via patient repeat visits. So we want people to come back to our hospitals. Patient experience surveys, in addition to keeping the organizations accountable, afford hospitals the chance to act on their promise to offer patient-centered care. Now, look at this. Patients don't necessarily seek to be satisfied when they're in the hospital, and they're definitely not going to be happy. Nobody is happy to be in a hospital, for no matter whether they're in there for lab work or a test. Rather, they just want not to be harmed. They want people to have empathy for them, and they don't want to be bankrupted by it. So you'll see it is complex, the patient experience and satisfaction, and it's generally linked with reimbursement. So our assignments for this week is to do a PowerPoint with narration. And it says political competence focuses on the outcome of the political system and to what extent it advances the best interests of the community. Develop political competence about an important healthcare policy. Utilize effective communication and interact with a legislator on this policy issue in your PowerPoint with narration. So again, I think at one point it says that your important healthcare policy should be linked with patient satisfaction, but you can use whatever healthcare policy is important to you. And again, you're not really going to interact with a legislator, but just prepare it as if you were going to. So just to remind you, if you were to go back to one of the introductory videos, here are some important healthcare issues and policies that are pertinent in this in our day and age. So artificial intelligence, Medicare Advantage, opioid crisis, cybersecurity breaches, again, our patient experience, price transparencies, disaster preparations, like what I talked about in that one video when I talked about the hospital in the middle of the hurricane, the tax reforms, the ACA, entitlement reform, prescription drug pricing, AIDS relief, value initiative, and then of course there's the ones that are more into our workforce, the nursing and physician shortages, staffing ratios, workplace violence, regulatory standards, hospital security, disease prevention, immunizations, access to care, reproductive and sexual health, gun violence. So there are many things that you can choose to research and write about. I'll say please make this a new experience for you. If you have written about one of these subjects in the past, please choose a different one so that you can learn something. Just definitions of the political competence. So it's basically the skills, perspectives, and values needed for effective political involvement within nursing's professional role, so that you can intervene in the broad socioeconomic and environmental determinants of health, or you can intervene effectively in a culturally diverse society, and you can partner in development of a humane healthcare system and bring nursing values to policy discussions. And then generally, it's the ability to understand what you can and cannot control, when to take action, who's going to resist your agenda, and who you need on your side. It's about knowing how to map the political terrain and get others on your side, as well as how to lead coalitions. So good luck with this week's assignment. And again, please contact me if you have any questions, and I'll see you online.